June 29th. Board meeting minutes.
I'll move to approve the June, whatever that date was.
The 29th.
Yes,
Sage,
June 29th.
Sage made the motion. Do I have a second?
I can second.
Thank you, Teresa. You want to do it
Yeah,
again?
I can.
All right.
Okay. Jackie,
Yes.
Teresa,
Yes.
Judy,
Yes.
Joanna,
Yes.
Paul,
Yes.
Faith,
Yes.
Sage, Live.
Abstain.
Okay. All right, motion carries. Is our guest here? Veronica?
Julie, are you with us? I don't think she is.
That's weird.
No, she's not.
Okay.
Okay, that's odd. There was a lot of communication back and forth, so I'm surprised she's not here, but let's carry on.
Okay. So shall we just review the updates from local jurisdictions? Then when Julie owns this, we'll just go back.
Yeah.
Okay.
Continue on without her.
Alrighty. Megan, do you have an update from the county of Mendocino?
I don't think I have an update from the county of Mendocino.
Okay.
I can't think of anything new or significant to share with you all that I haven't shared with you already about housing related issues in the county.
Okay.
You want to share about Homeward Bound?
I can, sure.
You want me to do it?
Why don't you do it? Why don't I can do it now and you can check in there. One small contract that we did put into place recently, and Sage is right, it's good for the whole community to know about this. We do have an official Homeward Bound contract in place with RCS to provide transportation for individuals experiencing homelessness if they have a place to go to that can be verified in some way. So this was a process. We had a sort of informal process of being able to pay for bus tickets through our Housing Flex Fund, but it was a little bit complicated, a little bit hard to like pin down. So we did a separate contract with Building Bridges for that service. It's live now and ready to go. So individuals that are seeking transportation outside of the county to return to their home, so can get that support at RCS Building Bridges during the day center hours.
Yeah.
During day center hours.
Specifically targeting folks who are literally homeless. And so they would come and present, they'd come and present at Building Bridges. We also want to be able to support people who are connected to partners. So if someone's connected to McHaven, they don't necessarily need to come to Building Bridges. We would be open to like you guys contacting us and being like, we have a person and we have very easy paperwork around it, just like a one pager. And then our thing is just verifying one, that they're literally homeless, and then two, that they have somewhere soft to land. So we are contacting the place to verify that they're not just going to go be on the street somewhere else or go stay in a shelter somewhere else. They need somewhere solid that is stable housing. So we verify that, and then have a little bit of a process around like confirming the like day that they're leaving, the time that they're leaving, that they have everything that they need to do the bus ride, and somehow securing. We've often asked that people come and stay in our shelter the night before the bus ride because it helps us make sure that they get to the bus stop on time. We've had some pretty bad, like unsuccessful experiences around getting people bus tickets and trusting that they're going to handle it on their own, and they miss the bus, and then we have to figure out.
So
Anyway, so
the if someone doesn't go with them with the ticket, you literally give them their ticket.
Yeah.
Oh, that's new. Okay.
Yeah.
In the olden days, we were afraid people would sell them.
oh, I have not experienced
I haven't
that
either. I haven't had no shows.
Their names, they have to
Right.
Yeah.
And they have to have their ID or they wouldn't get.
I have pretty understanding around if you say, unhoused and in a housing
Good.
crisis, I don't have my ID. Graham's been pretty good about
Good.
working with our folks, but
Good.
anyway, so if you have folks, we are definitely open to, and I'll be sending out a flyer and some better, like the actual referral form for it too, so.
Thank you, Sage. Other questions for Sage before?
Or Megan, really, this was.
Yeah, sorry, this is a contract.
I just
Yeah.
slipped it.
That's true. I'm glad you remembered.
Okay. And is Sarah from Fort Bragg online?
No other jurisdictions are present
Okay.
today.
Okay, so we'll go to standing committee reports. Back to you, Megan.
The strategic planning committee has not met since our last meeting, so we have no updates.
And Dan and I have been tasked with putting together a proposal of what the discussion on the board reconstruction, not
Reconfiguration.
Reconfiguration, thank you. And the revisions that need to happen to the actual governance charter. And so that's in progress right now.
Thank you, Veronica. Angelica, do you have enough?
Angelica is no longer an odds and error on my part. Angelica has resigned as chair of the Shelter and Solutions Committee. There has been some interest from members about making that happen. We're working on figuring out exactly who should be attending that meeting so that we can then schedule something that everybody can attend. So that's in process.
And Angelica, we thank you for all the help you've provided since the beginning.
I'm
sorry, I'm not Angelica.
Right behind you.
Right behind you.
We're all looking at you for a reason.
Thank you, Angelica. Okay. Coordinated entry discharge planning.
I'm going to just say I am very grateful for both Veronica and all the work that she's been doing, along with a lot of other stuff that she's been doing. Because when we took on, so Nutmeg Consulting is doing the coordinated entry list management, and they've been really taking off and doing a lot of work to get our coordinated entry by name list up to date, and then now getting the client exits and stuff up to date in HMIS, and really doing some great work. And I really appreciate the work that Veronica has put into facilitating that, because I've been fairly overwhelmed and not able to be supportive of the whole process. I mean, I'm supportive emotionally or like cheerleading, but not putting a lot of time in it. So I'm going to kick it over to Veronica for a more formal update on what is actually going on. But
Sage did a really good summary of exactly what we've so far. We do have a repeatable by name list in our system now. So we are also working on getting it to where agency admins can log into business objects, which is the HMIS data reporting system, and that there'll be a report in there that that can be repeatable, and they can just run it right then, and they don't have to contact the coordinated entry list manager for a new list. We're going to continue sending it out at the beginning of every month. So that, those who want to know what's going on, and so that we can do quality assurance and data quality. Nutmeg is working on exiting any enrollments that are over a year old, that don't have any active engagement in HMIS. So we're going to have that cleaned up to where our by name list is actually like maybe 50 people instead of 500.
Right.
Yeah, and we have a meeting this Thursday at 9:00 on Zoom.
I want to remind everybody that one of the priorities of the strategic plan was to identify a list manager and have this actually happen. So I just want to think we should all, congratulate ourselves for really chipping away that strategic plan, because this was a major recommendation from our state level TA consultants who recommended this, and we're getting it done. So
It's happening.
yes.
I have a public question or public comment. Who pulls from that list? Like what?
All rapid rehousing programs funded by ESG or through the COC funding. So it's any HAP funded programs or anything like that. There are several permanent supportive housing, no place like home funded projects with our CHDC, the Plateau Polls, CDC's PSH tenant-based rental assistance project. They were doing EHVs, but those are all leased up now, so. And there's no attrition to that project, so there won't be anybody new coming on, so that one's kind of ended. Did I miss
I
anything?
think you covered it, but I can think of.
Yeah, there's a couple, small like, projects like Blue House and Valley House are gonna be, they haven't started pulling from coordinated entry, but they will be as we work out that process. And then like Willow Terrace is somewhat kind of tied to coordinated entry, but not as formally as it could be. But
Not as formally as Oak Creek Commons and the Plateau. Those are
yeah,
to the letter, the process that both the funder and HUD wants us to follow.
Thank you.
Have no update on membership committee. Good one. And I think, oh yeah, no.
HMIS?
Yeah.
Are you?
Aya, do you have any updates?
Yes.
I'll let Aya do it.
For the HMIS Performance Committee, the most important thing that we have upcoming is beginning October 1st is the update to the HUD data standards. So there are a number of data points that are changing. We have a plan in place to QA any things that will be updated automatically by the system or by WellSky, our system provider. I'm going to run a list before and after to make sure that the appropriate changes were made. There's 7 or 8 manual updates to project types. It's not really changing major project types, but it's changing the way that they exist in the system a little bit. So we'll be taking care of those updates. The biggest change is updates to race and ethnicity and gender, which we will be putting together further documentation. We'll update our kind of advice page for workers on how to collect that information. Main topics with that is ethnicity, basically Hispanic, Latin, A, Latin, O, are being moved into with all the other racial categories. And then they're also adding a North African, Middle Eastern category as well. And you can choose any or all depending on your identity. And it will be a hit list, so you can choose them similar to the way gender is. They've made some changes with gender. And probably the other really big thing to note is in the response for in the kind of data not collected, it used to be that it said client refused to say. They're changing that language because it was determined to be kind of prejudicial. Now it's going to be client prefers not the state. And I'll be sending out any front facing language to every HMIS person, and then we'll be reviewing the assessments to make sure everything still works. So
Right. Awesome. Thank you.
Don't forget to do public comment.
I will. Do public comment on our standing committee reports. Okay.
Julie, is that you on the iPad? No,
I think
that's
that's Lynn's.
Lynn. Never mind.
Okay.
You're muted, but that's okay.
We could make Lynn do the presentation. Okay, ad hoc committee reports, point in time.
Okay, I am proud and happy to report that you have in your packet the 2023 point in time count results. They begin on page. And if anybody doesn't have it, there's a few copies of the agenda on this table. I only did a few, so there's not a whole bunch, but help yourself.
24.
Page 24, thank you. So what most people want to know about is on page. So the first page is a summary of all households that have at least one adult and one child. So those are the page 24 and page 25. 26 and 27 is persons with only children, so there's none. We didn't have any projects that serve that population, and we didn't find any unsheltered unaccompanied children. Persons in households without children, so these are single adults or couples or another configuration. And that's pages 28 and 29. And then starting on page 30 is what everybody wants to know, and it's the total. So we had a total of 385 households found that were unsheltered. The second line is number of persons, so that's 410. With our transitional housing folks and emergency shelter, it brings the total to 633. For reference, our 2022 point in time count was 830. So we reduced it by nearly 200. There were some changes in our methodology in that we started later. Normally, we would meet up at 5 and leave by 5:30 or 6. This year, we decided to try to do it differently, and we started at 9 a.m. That's the same that Lake County would utilize, and we thought it might be good to reflect our neighboring regions. And because of that, we didn't identify as many individual cars. We were able to like knock on doors and RVs and actually like have engaging conversations with folks. And so that's a trade-off. We have more information about people in our vehicles, but we counted fewer vehicles. And so that's just a methodology that we'll have to continue exploring and seeing if we want that later start or if we want to go back to early. I'm not going to dive into all the details, but there's detailed information on veterans as well as youth populations in this report. And this is the full report that has been approved by HUD.
So is this a report that will go to the board? Our board of supervisors when they.
You know, we have historically sent the report to the board,
Okay.
but what we also haven't done, and I think is long overdue, is a press release about the results, and which we should do. We haven't done in the past, and I would suggest it. I do want a couple of things that I wanted my thoughts to add to this.
Yeah,
please. Is that okay? Okay.
Yeah.
I allow that. What we've had in the past, a couple of years is, there was one year that we counted people that were in FEMA housing due to wildfire. I think the last 2 years, people that were participating in Project Room Key were included. I mean, they should have been included,
Right.
but it just, all of that has fallen away by now. And by January, we had very few people still in Room Key. So this is really kind of like back to normal in some sense. And I'm just super proud of you all because we've been putting a lot of people in a lot of housing. We've built a lot of housing. And if our results were not showing that, I would have been worried.
Yeah.
So I feel like this is validation on the work that all of you have done. I mean, really should
All of
take
us.
a lot of credit for it. I
All
mean,
of us, yeah.
the housing that's been built and all the work you've done to get people housed is reflected here, which is really awesome. So I'm super pleased. This is not the trend that a lot of other communities are showing. So we really should be proud.
So Mo, is there public?
So finish up with your board comment
Okay,
discussion and then you open it up to public.
okay. So the only board comment I had was, I really like it when we all get to this place because this is the information as we apply for grants or communicate as members of the COC. It's really great if we kind of use the same data. And so hang on to this part. But also in the past, I've had members of the board of supervisors say, how do you know that? Where do you get that? So there may be some interest there as well. So other board comments.
I'm a big fan of if we can get it together to do a press release and speak a little bit to the methodology. I think that helps with, like, we're not just making up a number.
Versus the education.
Yes. Right. And if there's any way also to kind of correlate it to HMIS data. And maybe we can't do that this year so much, but just in terms of like on any given day, how many active HMIS clients do we have? And who are like enrolled in programs and projects and stuff. And I don't know, just those would be some interesting things to start looking at, because I know there are communities that are using HMIS as part of their PIT. And
Oh, yes, we did.
and
I wonder, Sage, if we could look at, like, if we did last year, how many people in HMIS moved into permanent housing? Because we probably would show last year a lot more than the year before. Do you know what I'm saying? Rather than who's currently homeless, but maybe how many, because there should be a correlation between, we know people were homeless, we moved them into housing, and now there are less people on the streets in that sense. That HMIS should show us something.
So the reporting that comes out of HMIS, we have to remember it's all set up project-based. What is this project do? It's not what is this client doing? And so there's really no HUD report to say, of these clients in this project, what else are they doing in HMIS? Correct me if I'm wrong, Aya.
There aren't any, as far as I know, there aren't any canned reports that are like that, but there are ways to do that.
You could do individual specialized reporting like that.
Yeah, I've done it a couple of times for.
It's usually project specific though, but we can think of a way to do that. I mean, if you just did the whole universe of projects, or you
Oh, yeah, it's just because more.
You would maybe not include.
The information is there.
okay.
There gonna be, or is there now any breakdown of this?
There is. It's not in the HUD report, but you can actually go in anytime, Paul, into because you're a region captain.
Mhm.
You can log into that portal and look at all of the responses that were reported on the coast. And we can look at information like that.
How might I access that information?
You had asked about it and I was looking on it.
I just
And then
remembered
we
it.
decided to put a hold on it until this was finalized. And now that I'm releasing it to the public, we can definitely do that. So it's in our raw data. It's not in our reports, is basically what I'm explaining.
Cool, okay.
I think we'll also find that the trend line regional is only 2 years old, right? We can't do it. So, you know, you're starting kind of at the beginning with our regional, but you'll only have last year and this year.
That's great stuff.
It'll still be hard. We know the PIT has some limitations and sample size and all of that. So the smaller you get in a community, the harder it is to really.
Yeah,
Okay,
follow up with you on that.
so other questions, comments from board members? From the public
Yes.
and or Mo?
Welcome to the podium. Hi, everybody. I'm Mo Mulhern. I'm the second district supervisor for the county. And, you know, data is important. I think when we're talking about funding and how things are going, I think the community really wants to see that the work that we're doing is being successful. And this is incredible to me. You all should be so proud of yourselves. And I actually came here to say, please do a press release, please do infographics, please do something to tell people that the work that we're doing in our community is really paying off. Even better if you're able to get a couple of people that are willing to speak and talk about being housed and the difference that it's making in their lives. I know that some families have been housed in particular. So I did email this agenda with the point in time count to the Board of Supervisors so that they do have that in their emails. Because it really is that important that the work that you're doing is recognized by the board. So thank you.
Thank you.
So I will take responsibility for drafting a press release that I will then, you know, seek your input on. I probably will find a way to get quotes from some of you. I'm not exactly sure I'm going to do this yet,
Yeah.
but I agree with Supervisor Molnar, and I know it's important to all of you. We need to spread the word and share the messaging that we have been successful in reducing homelessness. And I also think that it's important for us to confront the question that will come, isn't it tied to your funding? If we're able to reduce homelessness by 23%, if we have a corresponding decrease in funding, that's a trade-off I will happily take. And I also want to point out that we are being held to pretty strict goal achievement through our HAP process that we're going to be able to show almost quickly, you know, almost immediately, that we're making an impact on that, which could, in theory, I think, open us up for bonus funding sometime in the future. You think not?
No, there is no bonus funding.
Oh, I thought there
We
was,
reassigned it to make HAP 5.
oh. In theory. But
When the bonus funding comes back.
Or we will not, but we do have to show progress in order to continue to, so I think
that-
overall, it's, overwhelmingly positive.
And just
For
like,
the state, sorry.
well, just to give a little over context, if our amount is based upon our point in time count. So if we have a reduction in homelessness, we get less money. And that's why there was bonus funding to reward us for actually achieving our goals. But the state legislature reassigned that bonus funding under HAP 4 to HAP 3 and 4 to make HAP 5. So we won't get fine. We'll get a pat on the back.
We'll get a pat on the back.
But there's not going to be any money with it.
But I think it's important to remember because you might, maybe some of you weren't following this because why would you? But there was a ranking of counties and how ambitious they were being in their goals. And like there were some jurisdictions that were getting a lot of criticism for not being ambitious in their goals. And we were like number 2. We were like super ambitious. Not only were we being ambitious, I think we're going to actually achieve it. So that's just great. We're on the good list.
It's not bragging when you do it.
Right.
Right.
I like that.
Right. Okay, any other comments before we close on the point in time count? All righty, funding review ad hoc committee, Veronica.
I want to be, well, the COC program competition funding ad hoc committee has finished its work and can be disbanded. They have a final presentation later on in the agenda. Okay. The HAP RFP panel review is in process. We had our first meeting this morning. It went pretty well. We're going to have a couple other meetings to do the actual review. But so that's in process and going well. And then I need to form a 2023 ESG balance of state ad hoc funding review committee.
So as a reminder for the board, this is emergency shelter and rapid rehousing, federal funding from HUD.
Funneled through the state.
Funneled through the state that requires some review by the COC.
Correct. A recommendation
A
pack.
recommendation by the COC.
So let me know if you're interested. I'm going to be like recruiting people.
What's the time frame? You're gonna be recruiting, when would you like? people
As
to-
soon as possible. Applications are due mid-October. I think there's going to be an extension though, because HCD didn't send out an announcement email saying our NOFA is available. I got lucky and happened just to be checking the HCD website, but there's other COCs that had no idea for like 2 to 4 weeks that it was open and completely lost that time. And so there's a movement to push it out. So we may get more time.
I have a question. How do agencies seek approval for support from the COC?
So the application is exclusively done online through HCD's eCivis. I sent out an email notification saying this is open and if anyone wants to apply, this is where you start. And it's on the HCD ESG website, which is where all the application information is at. We'll have a local review of all of those applications. And so that's the big part is I need to do an announcement regarding the funding and having a timeline and things like that. So I tried to do both that one and the COC at the same time, and I just couldn't pull off the ESG.
Other questions from board members? Comments? From the public? Okay. Let's move ahead to board protocols and governance. Oh, are we gonna wait on Dan for this?
Well, the board meeting is in person, we probably can talk about.
Okay,
Julie, are you there?
Still not there.
No, I just let her in.
Oh.
I
Oh,
am here. I'm hiding.
excellent.
I was stuck in the waiting room for a while.
My apologies. We were discussing and I was looking the wrong direction. Do you want
So,
to-
yeah, welcome, Julie. We will switch gears and ask you to make your presentation. Welcome.
Okay. Are you sure? Because I have a little, I can
For
go.
sure.
Okay. All right. I will then share my screen.
Okay.
Hi, everyone. Sorry for the interruption, but it's important stuff and good news. So appreciate you all. I'm Julie Silas. I'm with Home Base. I know we've worked with you all throughout the years. We are a nonprofit that works to prevent and end homelessness. And we've had a chance to work with Veronica, particularly on the new Homeless and Housing Incentive Fund program. So today is a very different subject. It's about Medi-Cal renewals. And what I'm going to start with is this is a one slide that I hope by the end of my conversation, you all will have fluency in this topic and you will be able to take this one slide with you to your staff, to any meetings you go to kind of help get the word out. And so the idea here is like, this is a brief overview of all the things we're going to talk about in 15 minutes, but I'm going to tell you them in a minute. That there's been a 3-year pause, people haven't been required to renew, and now that everyone has to renew Medi-Cal, millions of people are at risk of losing their Medi-Cal, especially people experiencing homelessness, because almost the entire campaign is based on having a regular mailing address. And so Home Base is doing this campaign, going around to all the COCs and asking you all to help spread the word and bring awareness to all your staff, to consider offering your a mailing address at your sites if that's possible. And then we're having a webinar, a big webinar in October that will go more in detail. But right now I'm going to spend a few minutes just kind of giving you all some basics. So Medicaid is the state public health insurance program that covers low-income families, children, people with disabilities, seniors, pretty much everyone who's low income in California. And it's called Medi-Cal in California, but everywhere else it's called Medicaid or some version of that. And we have about 16 million people in California who receive Medi-Cal benefits. And hopefully there are a lot of people experiencing homelessness who are enrolled in this program. California has a more expansive program than other states for two particular reasons. One is for young adults and elders, we offer Medi-Cal without regard of anyone's immigration status. That's current, but starting in January 2024, that's going to be for everyone regardless of their age. And that isn't the case in most states. So we're more expansive in terms of we're able to touch more people's lives. And then we're more expansive because of the CalAIM initiative, which you probably have heard about. It has two really important, there's tons of benefits and tons of new programs under this initiative, but two that are really important for homeless systems of care and people experiencing homelessness are the enhanced care management and the community supports. And the reason I have this up here is because the only way you can access these benefits is if you have Medi-Cal. So anyone experiencing homelessness who has Medi-Cal today but doesn't renew is at risk of losing these really important housing related services. But you all as a COC have something to risk as well, because right now you all can be providing housing navigation. You might have partners who are providing housing navigation, housing deposits, tenancy and supportive services paid for by Medicaid for your clients, which frees up your HUD funding, your HAP funding, all the other type of funding you have can be used in other ways. But if people lose Medi-Cal, then that funding source that you can use to provide these services will disappear for that individual. And it means that you're having to provide those supports to them through other funding. And so not only is it at risk for individuals, but it actually closes off the door for you all as a COC to leverage healthcare dollars in a way that you wouldn't be able to do. So what do we know about Medi-Cal renewals? They come in the mail and not everyone has a mailing address. In addition to not everyone having a mailing address, there may be people who over the last 3 years were homeless and found a home, but they may not understand or realize that in order to get their Medi-Cal notice, Medi-Cal needs to know they have a new address. So it's not only the people who are currently homeless, but anyone who over the last 3 years has experienced homelessness or changed their address and hasn't been aware that they need to let Medi-Cal know about it. This is sent in the regular mail to the last known address. And the anticipation is in California, since they have almost 16 million people to renew, it's about 1 million, a little over 1 million every month. And they expect 2 to 3 million people are going to lose coverage in California. And over half of them are going to be because of procedural reasons, not because these folks are over income, but because they didn't file a notice, they didn't fill out the application, they didn't get the notice in the mail, they didn't show proof of change in income, etc. So what we call those is procedural issues. So the thought that half of people are going to lose because, not because they're not eligible, but because something went wrong in the application process. So I'm here today to try to help you all know and have some tools that you can have for helping people. Like I said, you lose health coverage, you lose a lot of the housing supports that are covered under healthcare for Medi-Cal. And then also for those who are losing it, who are eligible, going on and off Medicaid and having health coverage and not having health coverage can be really costly, both to the system, but also to their poor health outcomes. And people experiencing homelessness are at higher risk for some of these things. And we know that not having health care, people are aging faster in the homeless system of care. So the unique challenges are because these are going to people's known address, they may not get a renewal notice, they may not get the renewal packet, they're eligible for automatic renewal, but they won't even know they were automatically renewed if they were eligible, and they won't have translation. So if they use language other than English, they get this Babel page, which has, hey, this is important notice, call here for more information in your language of choice. And they won't even get that. So they won't even know what the notice is about. So big risks. One of the cool things, and Veronica, this is different than what I sent you because hot off the press, the Medi-Cal policy changed on Friday in a very good way. And so this slide I'll send you when we're done. It's the only slide that I changed. But there are 2 new special rules that will simplify the renewal process for people experiencing homelessness. The first one is the most important. If someone has 0 income on record when they applied Medi-Cal, or they were 100% of federal poverty or below the last time they told Medi-Cal anything about their income, they will no longer get a renewal package. They're going to be automatically renewed. This is new because last week, they were waived that they had to prove their income was what it was, but now they're like, nope, if we know that they were 100% of poverty or below, or they have no income, we're going to automatically renew people. The issue is, how do you know if that happened? This is a huge, big, great policy change. It should impact most people experiencing homelessness, but they aren't going to have the ability to know because they won't get that renewal notice in the mail. And so that's one thing that you all can do, is you can help your clients figure out if they've automatically been renewed. And we'll talk a little bit about what that looks like. The other special rule that they created was, if the county knows someone is experiencing homelessness, they will auto-renew they're not calling that. They will restart their Medi-Cal eligibility from the date they find out the person's homeless. So for example, if my renewal is due in December and I call the Mendocino County Healthcare Department and I tell them, hey, I'm experiencing homelessness right now, the person on the phone has the ability to restart my Medi-Cal enrollment date as of today. And so I won't have to renew until September 2024 instead of December 2023. So those are 2 really big things. And both of those things are dependent on people contacting the Medi-Cal office or having some way to look at their account to find out if they've been renewed. So we'll talk a little bit about what that looks like on your end, how you can help. Before I get to this, does anyone have any questions about what I just said? the special rules clear, the process of what is happening clear. Any questions? We're good? I see all of you, but if someone can wave their hand to say, yes, you don't have any questions. All right. So how can you help? So you can help people update their contact information.
Judy has a question.
I have one
Yeah,
question,
Oh,
okay,
Julie, we do have one question in the room, sorry.
go for it.
of course.
Mhm.
So Julie, I was just wondering, so you don't check if, which is great, for the person who's already had poverty level, et cetera. So then at the third year, do you check or do you just keep on?
Okay. So the updates have to happen every year, but because of COVID, the federal government prohibited states from asking people to renew. So
Right.
for the last 3 years, they didn't have to renew, but normally they renew every 12 months. And so this means that right now, every single person who's ever been on Medi-Cal in the last 3 years is having to be renewed for the first time in 3 years. And so I might have applied in May of 2020. I might have applied in August of 2021, and I haven't ever had to renew. But in August of 2023, all of a sudden I'm having to renew.
I
And
think
so
there was a question about the very low income exception.
Yeah, the very low income
yeah,
exception.
I think the very
Yes.
low income exception's for 1 year. Am I right?
Well, once you apply, that's what I was going to say. So for the last 3 years, no one has had to renew, but every time you renew, it's only for 1 year. And that will always be the case. So this exception, these two special rules are only right now while they have 16 million people they have to renew.
Got it. Okay.
And then we're going to be working with DHCS. DHCS has said to us, this is a crisis right now. Let's get through the crisis, but we also need to solve the problem of people who don't have addresses moving forward, that this doesn't solve. It solves it for right now with this mass amount of people who are being renewed, but it doesn't solve that the problem, the way we re-enroll and renew people is all through regular mail. So we've got to figure that out. So that hasn't been solved yet, but right now the renewal through 2024, September 24 is what we're talking about. Is that more clear? Sorry.
Yes, thank you.
Thank
Okay.
you.
Thank you.
Okay. So what happens also is that everyone's renewed from the date, the month that they applied. So if you apply in September, your renewal is the next September. If you applied in October, your renewal is to do the next October. So every month there's a new batch of about 1 million, a little over 1 million being renewed. And you don't know what the people you're working with renewal date is. So there's ways to know if they have a Medi-Cal account online, they can go online and find out when the renewal date is. And that's something you can do and help them with. If they don't have a Medi-Cal account online, but they have their Medi-Cal account number, their card, they can create a Medi-Cal account. And within an hour or two, or maybe 24 hours, if it takes that long, but it's supposed to not take very long. If they sign up through a Medi-Cal account and then they go back a couple hours later, they should be able to find out what the renewal date is. It flashes at the top of the screen, your renewal date. So that's
Lily?
all. Yeah.
Can I tag on to that?
Yeah.
One thing that Lily Caravello, who is our outreach and navigation
Unit person.
unit lead,
Yes.
and she's highly involved in the Medi-Cal renewal process. She wanted me to remind everybody, do not use your email account to sign them up. If you do, they will never have access to their account without your email address.
Yeah.
You will never be able to use your email address to actually sign up for an account. So it is imperative that if they do not have an email account, that you help them sign up for a free one and use that one.
Yes. Yes. You can see
I'll
that.
just echo that too, just because we have service providers in the room and they work with other people. It's also really important that unless you have some reason that makes sense, do not make yourself an authorized representative for somebody who's enrolled in Medi-Cal. I think lots of times advocates are trying to be they are advocating and they're doing, but that unless there's some sort of really clear reason. Somebody who is a paid staff person should not be the authorized representative for somebody that they're helping.
Yeah.
Because it's done in their name,
It's their
not
name,
the
yeah.
agency.
Right.
And so if you
Yeah.
leave that organization, you're still signed up.
So those are all really good points. So we're focusing on if you all can help people get an actual snail mail address. So that if you're in a shelter or you have a navigation center or you have a drop-in center, and you're willing to have that be someone's address, that is something that we are encouraging shelter providers and other providers to share for people so that they actually get their notice. And what's nice about that is when they come to the drop-in center and they find out they got the notice, there are staff there to help them fill it out, which is really nice. But yes, you would not want to use your own email address, and they have the ability to put their phone and their email in when they get an account, and that is really helpful. But you can always do things with them in the room with you rather than be an authorized rep. Our authorized rep is a more formal role where you're being authorized by the person to be their voice and speak on their behalf. And you can, in the alternative, rather than do that, get on a three-way call. So if you're working with someone who's in an encampment and they have a cell phone, they can call Medi-Cal and then add you in, or you can call Medi-Cal and add them in, and you can have a conversation with them. You can, when they're in your office, make the phone call to Medi-Cal, or you can go into Medi-Cal together. So those are the preferable things to do than share your email address or become an authorized rep. So the idea here is to make sure their contact information is updated. Maybe they have a new cell phone. We know a lot of people experiencing homelessness change their cell phones all the time. So you want to make sure they have that. Yes, go ahead.
I was wondering, so during the pandemic, there was an availability for families that didn't have a permanent address or a local address that the pandemic EBT cards could come to school sites. Would you recommend potentially a school site address in order for them to get their enrollment?
If they have a relationship with that school already for the reason that you just described, I don't think that's a problem. I think that's really up to that school to say that we're willing to do that. So each of you all as providers have to make those decisions. But if the providers are willing to do that at the school and they're already doing it for EBT, I think that makes complete sense. And there are folks working on school trying to get anyone who's affiliated with a school streamlined as well, in the same way that we're doing for people experiencing homelessness. But absolutely anything that you all are willing to do. We just were talking to another county where there was a provider who said, hey, we're going to open up our office hours, telling everybody, hey, come to our office these 3 days this week, and all hands on deck to help you renew, help you tell Medi-Cal that you're experiencing homelessness so you can take advantage of that second option. And their Medi-Cal office was on the call and they said, hey, we'll bring our staff there. If you tell us what those 3 days are, we'll bring our staff. So it's really any creative thing you all can do. I think the county, no one wants the counties to no one in the counties want people to lose their healthcare coverage at this point. So this is a really awesome opportunity to collaborate across the homeless system of care and with the Medi-Cal department to figure out, like, how can we do this well? Do we have a fair? Do we partner? Do we send some of our health enrollment navigators with street outreach to do it at enroll and re-enroll people at encampments? There's tons of opportunities, and really looking at how can you all do that as creative as you can. So if you go into Medi-Cal account and they're not online and there's nothing about renewal, then picking up the phone and calling the county or visiting the county with your client is the way to go. And the really big thing is, have I already been renewed? Do I not have to worry about it? And what's my next re-enrollment date? What's my next renewal date? And if not, can you do it right now because I'm experiencing homelessness? And if not, I feel like I'm eligible for that 100% federal poverty level. Can you look in my account and see if I should be auto Or have you already done that and I just don't know about it because I didn't have an address for you to send it to me. So it's a combination of all those things. And even in these really amazing special rules, it still requires some contact with county to find out if you've been already enrolled, what your re-enrollment date will be for next time, and then updating any cool contact information. So Veronica put here a website of how to create an account online and then how to link cases. Those are from DHCS. And then I'll show you, there is one other site, this keepmedicalcoverage.com. That is, not only can you get the link to the online account, which is benefitscal.com, but you also can go there and find out about health enrollment navigators who are helping people renew, and collaborating with them as much as possible, because that's their job, is to help people apply and renew. So you can go to that page and it will show you the health enrollment navigators in Mendocino County. And then this is the social service office, the Medi-Cal offices, one in Fort Bragg and one in Ukiah, for you to do. Some of the local offices go through a big call center, and some of them have local call centers and they're easier. And some of the call centers it's hard to get through.
I don't think we have a call center.
Here's all your health enrollment navigators. I think this is yeah, that's the list. And Veronica has this PowerPoint that she can send out to folks. Some of these places will accept walk-ins. Some of them are over the phone only. They usually have a specific person who's dedicated to helping. And I would say, just in general, these are really good people to know in terms of the intersection between people experiencing homelessness and people who, and the same people who have Medi-Cal. We are hosting a webinar for an hour and a half on October 3rd. You can take a screenshot of this, and we're going to be sending out, Veronica will be sending out an announcement and a flyer in the next couple of days through the HIP listserv. And people can sign up for that, so that if your staff wants to come, we're going to go through this a little bit more slowly. We'll be there for questions. We're going to hopefully have some health enrollment navigators on the call to talk about how that goes. One especially important thing from our point of view is we have this great line with DHCS where they really want to know how this is rolling out. And, if they have these special rules, are they being implemented correctly? Are people having problems? Are there things we need to do differently? Do we have to change a policy a little bit? So we're asking folks to contact us at medical@homebasedccc.org. So as you start to do this, if you have successes, if you come up with something really cool that you're doing as a fair, or something that just wholesale gets a lot of people enrolled, or you've called and you're put on hold and then you're hung up on, those are the kind of things that DHCS wants to know. And so if you want to send us a note at medical@homebasedccc.org, it's not to tattle or anything. It's really just to help them see where there are patterns that are unique to a county, or they're happening all over the state, and there are things that they can do to help streamline the process more. So please send us those ideas or problems you have. We can also get on the call with DHCS and help you solve problems if you're having ones that you can't solve yourself. So keep that email around. And then we are hopefully in the next, 4 days, if not sooner, we have a toolkit that we wrote that's specifically for providers serving the homeless population, that talks about all these recommendations we have, that does an overview of Medi-Cal, that does how to help people enroll, that has lots of links, that constantly reminds them of how to find out where their Medi-Cal office is. And that will be posted on our website, which I will put in the chat right now while we're talking. or when I'm done talking, because I can't see my chat right this second. But we will, we have on our website a tool, we will have a toolkit that's written. There's literally screenshots of how to sign up for a Medi-Cal account with directions on what each screenshot is and what to fill out and how to go from one screen to the next. So we have a fact sheet to take with you if you're doing any street outreach or with shelter residents, anything you want to do to reach people experiencing homelessness themselves that are written at a lower readability level or actually higher readability level that you can share with your clients. And so all those will help people. A lot of them are not going to know until they go to the doctor and find out they lost Medi-Cal. And that's what we're trying to avoid. And for some of them, you know, they just never, this hasn't been what they've had to do every year. And that's restarting. And without knowing that that's what they had to do for the last 3 years, they had Medi-Cal without having to think about it. And so this is going to be a surprise to them if we don't get the word out. So I think that is it. I'm happy to take more questions. I will, oh yeah, now I can put in the chat. Oh, I don't have the chat.
No, it's a Brown Act meeting. We can't use the chat, sorry.
Oh, I'm gonna tell you all that our website is homebaseccc.org, homebaseccc.org. And if you do a /healthcare, that's where all our Medi-Cal stuff will be. And Lynn had a question. Sorry, Lynn, for taking so long. I saw your hand up for a while.
Oh, no, I'm the public, so you can wait. I can wait till
Okay.
it's an appropriate time, but I have a couple questions and a couple comments.
Any questions from members?
Yeah. Right. Any questions from board members for Julie before? Okay. So I think we're on to Lynn.
Okay. Before Lynn talks, I just want to say, Veronica, if you could share that single slide, I think that's a really good one for you to be able to take to your teams for your next staff meeting.
Which one is that?
The first slide, the one that looks like this. Hold on. I'll flash it over to you. I'm hoping you all could share this slide. And it's just something that you could easily take with you to your staff, this one. It's sort of like a little prompt. It tells you, you can go to your staff and say, all of a sudden, for the last 3 years, no one's had to renew and they have to renew. Millions of people are going to lose, especially people experiencing homelessness. And then you could tell them about the webinar using their mailing address and then the link to the tool. So hoping you all can use that as you see fit to help you bring this back to your constituents, your members, your staff, and people you're serving. Okay, go ahead, Lynn.
So I wondered if you could just repeat the part about reporting the homeless, someone is homeless, and the effective date, and then if it can only be reported through social services or if an enrollment assistant has any ability to do that. And also, I know sometimes getting through to social services right now can be a very long wait on hold. Yeah. So that's just one question. I have a couple more comments. I'll add.
Let's answer that one, and then we can get to your other comments. So, it has to be through the Medi-Cal agency, which is what I'm hearing from you all is your DSS, Department of Social Services. So the call has to be made to DSS. It's possible you all can experiment and one of you could call and say, hey, I have a client, but your client would have to be with you when you made that call because they won't accept any information that's personally identifiable information without the client in person or on the call with you. So those are the kind of things like you can be on hold and ask your client, as soon as I get them on the line, can I call, bring you in? So that's something to think about. Or if they're in the office with you, you can do that. But it is a challenge when there is such a wait for those calls to go through.
Can I make a suggestion on that though? I think, so if you have a client and you're calling into the county Medi-Cal office or you're making that contact, I would recommend you actually go through the renewal process or do what you need to do to finish the renewal rather than just calling in to say I'm homeless. I think it'll be better for you in the long run. to do that. So I guess my only situation where I think that would make sense is if you literally cannot think of any solid address that you have in your life. That would just be my recommendation.
Yeah, and I don't know if I agree with that solely because if they're due for renewal in October and you call them today and you renew, you don't have a renewal yet. So you
I
can't,
see. Right, that makes sense. I'm sorry. So
Yeah.
if you have one in the future that you don't know where you're going to be or how reliable you're going to be. Right.
yeah,
I'm sorry, Julie, I misunderstood you. I feel like if you have a renewal, just do the renewal.
Yes.
Yeah.
for someone who has the renewal, because it's their particular month of renewing. One of the first questions that they get on the renewal online is, are you homeless? And you can answer yes. But if they're not due for their renewal until October or November or December or January, or February, or March or April, or May or June or July or August, and you call them and you tell them they're in September that they're homeless, they won't have to renew or do anything until next September.
Okay, I'm sorry, that makes much more sense.
Yeah. Yeah. So I agree with whoever was talking. I agree with you for someone who has an active renewal right now. It's better to just finish the renewal. But for anyone who is experiencing homelessness, basically you postpone the renewal by 12, up to 12 months by doing the I'm homeless.
Julie, what if, before, when we suspended this annual renewal thing, the person wasn't in Mendocino County, but they're in Mendocino County now?
Yeah, if you have someone who either county, you can do it. You can do it at the county they currently are living or the county where they originally applied. So if you have people who originally were in Mendocino and now are in Contra Costa, they can call Contra Costa or Mendocino and vice versa. If they were in Contra Costa and now they're in Mendocino, either one. You can just say, I'm currently experiencing homelessness and I'm in Mendocino.
Thank you.
At least that's what DHCS tells us. This is the kind of thing we might need to hear from you. Is that not what's going? Does that
work? Yeah.
does that work? And if it doesn't, let us know.
Okay, that would be one I'd be really impressed with if it's working. So I would be curious about that.
You got my hopes up.
Yeah.
Yeah. And it's funny because we were on a call a couple weeks ago and someone told us when they got the renewal packet, it was out of order and the staff person couldn't figure out what order it was. It was really hard to follow. And I made mention of it on a call with DHCS and they wanted to know what county you're talking about. So they really want to know the specifics about it. So if you find that you're trying to help someone who's in Mendocino now, but was from Contra Costa and they say, sorry, we can't help you. It has to be in Contra Costa. DHCS would want to know about that.
One last comment, the renewal packets come in a very bright yellow envelope. So sometimes you might say to your client, they'll be, I don't know, I get all this mail. I don't know what I got. Say, did you get a bright yellow envelope? Because those are the ones you should be on the lookout for.
Yeah. And the other cool thing, which we didn't have enough time to do a slide on, but if they lost their renewal by not finishing the process or not getting the packet, and then you work with them and they find out and it's still within 90 days, you can get them back in Medi-Cal without having to reapply. And then it reinstates back to when they lost it. So they have continuity of coverage. So that's an important thing. If you find out that someone, and our materials talk about how you can help people. It's called the 90-day cure period, where you have a little bit of time to still fill it out or finish the process or tell them you're homeless without officially having to restart the whole application again.
So this is Lynn, oh, go ahead.
Yeah, I have one more quick question, and Veronica, you probably know the answer. The folks that we're serving that have a rep payee, do they use the rep payee address? Is that where they're?
I mean, I haven't a clue, but those would actually be through Social Security.
Right.
And that's a separate renewal.
Separate, but a way to know.
I've seen it when I'm inside the Medi-Cal system. I have seen that people's rep payees are their mailing address.
I thought so
So
too.
I don't know if it always is, but it's an option. It's not.
Often, I'm wondering if those people know what's happening.
Well,
Right now.
folks that have social security or SSDI or
Right,
SSP,
right.
their Medi-Cal, their Medicaid really is
Right.
authorized through the Social Security Department.
I see.
And that's who processes all of it. I was talking to Lily, my counterpart, about this. And that's a separate renewal process and it wouldn't fall under this.
Okay,
Correct me if I'm wrong.
so this is
Yeah.
just Medi-Cal.
Just straight Medi-Cal partnership, no social security.
Okay,
Are we open to the members public yet?
yeah, yes.
So I just wanted to share, I worked for a rep payee in the past and yeah, it goes directly to the rep payee and the rep payee helps renew.
Thank you.
Thank you. And then Lynn had some more questions.
Yeah, well, just a couple things. Recently, like very recently, we have the plan has developed the capability for our clinics to be able to download lists of members that are up for redetermination. This is something they've been really wanting for many months. So we're just rolling that out. And so that will be another avenue for the clinics are as Julie said, it's a great presentation, have all the same concerns about people being missed. So the clinics will be actively, some of them actively also reaching out to their clients to help them with enrollment. And many of them also have staff who are trained as enrollment assisters. So that's great. I just wanted to make sure that you were aware of this new opportunity to find out when people are up for redetermination.
Yeah, Lynn.
Go ahead.
Can I just enhance what you said and say that's a really important thing? If you know one of your clients has Medi-Cal through partnership, then calling partnership and seeing if they can tell you if that person's already been re-enrolled and renewed already, that would be great, right? That's an easy way. You have a contact person at partnership and they can look that person up. Again, probably need your client with you or on the phone with you through a three-way call, but there are certain partnerships where they're doing data sharing, and with managed care plans they are, and so they have a window into more updated information than you might have without that. So that's a really important resource. Okay, Lynn.
Oh, and then just the last thing is, just looking at our numbers again, partnership members, not absolutely every Medi-Cal member in Mendocino County is with partnership, but most are, we've seen a change of 738 members between June 1st enrollment to September 1st enrollment, which I think is smaller than we were anticipating. Of course, it's early in the process, but we are, everyone's working really hard, and it's showing, I think, in those numbers. So
Yeah. 738 people is a lot, though, to lose Medi-Cal in a small county, right, in 1 month. So I know
that's several months between June and September. So correct, but
I don't want to spend too much time because we've told you about this, but I do want to point out that probably not the populations you're working with, but there are some people who are actually legitimately not eligible for Medi-Cal anymore. So there will be some people whose incomes have changed in a way that make them no longer eligible for Medi-Cal. So some of those losses are accurate.
Are real. Yeah, we were on a call with DHCS, and I think it's 20% of the renewals are losing based on 20 to 25% based on procedural issues, right? So those are what we talk about when they're still eligible, but the process has let them down rather than their income is increased or they have a change in family size or something like that. But I could have that number wrong. That's a lot when you look outside of just one county or one population.
How are we doing? Other questions? Okay. Thank you very much.
Thank you. And thank you for letting me interrupt your all's presentation. Thank you all for the hard work you do, and definitely stay in touch. If you have any stories, good or bad, or need some help with any challenges that you have. And thank you all so much for your hard work. Bye. Thank you, Veronica.
Take care. Talk soon.
Okay. Well, that's a lot to digest. So let's move on to something. Yes. So I think we're to funding.
Board protocols and governance.
Yeah, we'll skip E2 probably, but you want to let Veronica.
Okay.
Okay, so the next item is a discussion on the COC board meetings, return to in-person meeting format.
Here we are.
In your packet, page 46, there is the news release that I issued regarding our return. I attended a county hosted training on the Brown Act, but it wasn't county council. It was, I cannot remember the law firm off the top of my head, but it was a law firm that was contracted. And I learned that there's 3 pieces of legislation that are at play. There's the original Brown Act. And then there was an act, there was legislation that passed that allowed us during times of emergency to meet on teleconferencely. And then a 3rd piece came out and it was effective January 1st that said that it kind of expanded on pieces in the original legislation, which allows board members who have just cause to be able to attend meetings teleconferencely. It's a maximum of 20% of meetings that a board member can attend virtually. But the just cause is pretty broad. It's care for a family member, if you yourself are sick, if you're traveling for work-related purposes and you're not physically around, things like that. So anytime that a COC board member knows they're going to need to attend via Zoom or other method, I need to know in advance so that I can make that arrangements. We also, there's some other pieces of information that I linked, not in the press release, my apologies, but I sent out an email to the full COC about this is where you can go for more information about what that just cause looks like. And it's a 1-pager explanation by the law firm that does a great job. Any questions from the board?
Veronica pointed out that we get to do it by calendar year. So we have only 2 more meetings this year and then the 2 meetings turn over again.
Establish a process. What is our year? But our board uses a calendar year, January through December.
So it gives a little bit more room for remote. So we have to get used to this.
This month, October and November, we don't have a December meeting, and then we'll restart January.
Does that mean you're going to have to keep track of how many we attend remotely?
Wow.
Oh, good. You know, I like data.
I'm just going to use a bold.
There we go.
Yeah, we can.
Yes.
You know, I just want to kind of register some level of a complaint because I'm kind of a complaining person. You know, when I think of, you know, a continuum of care is supposed to be countywide and that we sometimes have had participation from, you know, for a while, someone from Point Arena, or, you know, it's great that Paul drove over from Fort Bragg. But, you know, I certainly would be thinking twice if I was going to have to add 3 hours onto my day to attend a meeting. And since we really are wanting participation countywide, we'd like to expand it. I find this just a little bit sad. Not that I don't love seeing all of you in person, but you kind of based. And I know before we have tried at times to move the meetings, but that also has its own headaches that I can't even imagine in terms of setting up, making sure that you have the
Also, then
setups.
we lose the participation of that meeting,
Yeah,
which is not fair.
Just cause would include the weather is really poor and it's unsafe for me to go.
Yeah.
That would be just cause.
But it's still only 2, right?
Would just cause also be for those persons living in outlying areas that it's impactful on their work calendar? Travel inland? I would think so, because often on calendars, people have back-to-back meetings. And
I'm hesitating and leaning towards no. And I'm using the Board of Supervisors as my example because we have 2 supervisors who live on the coast and have to travel to Ukiah in-person meetings.
I think that's their job.
Yeah, I,
Same rules, no matter what.
yeah, but, yeah, I think Joanne is on to something.
I am onto something.
And so there are leaders, they're elected leaders. We have taken on this task across a large distributed population in a huge geographic area. And so I think, I don't know who the god of the Brown Act is that we have to go ask for our exception. But if we were in private industry right now, we would say this does not meet our business needs. You're holding us to rules that do not increase participation, and that's what we need to do. So, I don't know where we go with this, but it is limiting.
We have to remember, though, this is public funds.
Right.
These aren't private dollars. This is funds from the community.
And the people in Covelo deserve
The right to see what we're doing.
exactly. So, but to participate, I think what we're doing is making it more difficult for people, for the more balanced participation. That's my concern, but
I also think that the Brown Act probably hasn't updated its rules to reflect the actual needs and the needs that have changed since COVID too, with the way businesses are ran. They haven't changed to include.
That's inaccurate.
Yeah.
That's what the third piece of legislation that went into effect this year. It was to expand, to loosen up the requirements of the Brown Act. It allows for teleconferencing to where you don't have to make it accessible to the public anymore. It used to be, let's say that Paul couldn't make it and he was in Fort Bragg. He had to open up his office and we had to publicize, Paul is at this address and you can go participate in the meeting at this location.
That's true. There is that piece.
That's gone now.
We could have coastal access because we had it before where people did not have to drive over. They could participate in different.
That was pre-Brown.
Right, where they could attend at the county office. I think it was in Fort Bragg rather than driving over the hill.
yeah.
We get the equipment.
It's hard to remember because it's been a number of years, what that encompass for affordability for people to stay within their community.
Right.
You might have to look that up.
And it's only COC board members that this is required of. It's not regular members.
Right.
It's not representatives from different jurisdictions. They're all welcome to attend via Zoom. It's the board members who take on that. They actually get a vote.
Right.
They have to be in person as much as possible.
So any other board comment before I ask for public comment on this one? Mo, did you have something?
When do I not have something? I just wanted to offer that on several of the boards that I do sit on. They are countywide and we do allow remote participation. So somebody could, or there could be a location in Fort Bragg, there could be a location in Willits, they could remote in and then that would serve because it's countywide board. So they don't have to physically be in Ukiah to be at the meeting. And I think that the legislators in Sacramento do need to be physically present. So sometimes they miss what us folks in rural counties have to do, but there at one point we're over 20 bills trying to change the language. So I think that we're not done yet with what the changes will be in the future, but there definitely are more opportunities to allow for participation from outlying areas, even at this point. So don't give up. There's more work we can do and I'm happy to help.
I would just add too that I don't really want to open this can of worms right now, but I do want to, if somebody wants to pursue it, there still seems to be some COCs who believe they're not required to follow the Brown Act. So we had been advised that we had to follow the Brown Act about 6 or 7 years ago, but it does still seem to be an open question. I'm not advocating that we should not be Brown Act compliant, but I'm just letting you know that there's a difference of a legal opinion in different areas. I know.
It's like succeeding in a union.
Well, I don't know. Sometimes if you see being Brown Act, it looks like you're trying to hide from the public, which you're not doing, but we've had a lot of trouble with quorums. We have a lot of trouble with public. There is. Yeah. So there's comes with pluses and minuses, the Brown Act requirements.
Okay, something for us to watch, yeah.
So Joe brought it up because it's just so handy dandy. And to be able to look for things. And there's a clause in here, and I think that the language can be interpreted different ways. So this is under teleconference rules. Bullet point says, one or more members of the legislative body, but less than a quorum, have just cause for not attending the meeting in person, and in parentheses, it states, childcare or family caregiving need, contagious illness, physical or mental disability need, or travel while on official public business. I don't know if that's that travel while on official public business.
If you're out of the
This,
area.
or at something else, that's where it's a little open for interpretation, because you would have to travel.
There's
There's
further language that talks about
breaking
how the
it down.
travel has to be related to the work of the group.
Right.
So if you're on vacation, it wouldn't be.
Well, I think we have to watch this one.
Yeah.
We're not gonna solve this one today.
No, I just think that we need to explore it more,
Yeah,
because the point, of course, is that we want inclusion,
yes.
and without disruption of work as little as much as possible. And so the inclusion is important. Many voices make a whole. And we really need inclusion from outline members to know what is exactly going on in their communities. I would hate to have a lot of people have sick children all of a sudden, or a sick parent. I would really like us to be transparent and supportive. So I just would ask that we really look at the language to find ways that we can support people in our very rural county, which takes forever to get from one point to another, and the price of gas. So that's just my 2 cents.
Okay.
Agree.
I'll
always be that advocate in the group that just stirs a little bit. So you guys just know that
Well, we're
it's
gonna cut
always
you
for-
off stirring so we can get to the agenda.
Yeah. It's always for the better good, in my opinion, and probably others too. So
Okay.
just
I
be
agree with you.
patient with me. Thank you.
And I think we said a number 2 was for next agenda.
So I kept this item, updates on the governing board seat redesign.
Right.
I kept it on there so we don't forget it and we don't.
Okay.
lose it.
Perfect.
And it's just gonna be on there, and if we have updates, great, and if we don't, we can just move on like today.
Okay. Perfect. Okay, so
We probably should open it up for public comment.
public comment. Public comment on what? On the board, on the redesign. Oh, okay. Then we'll move to funding.
Okay, we have an issue. We only have 7 board members present. We no longer have a quorum because Sage had to leave early. That means that we cannot discuss the COC funding application, which means that we're going to have a special board meeting to where we can approve it. I cannot submit it without the COC board's approval.
Right.
And it has to be a minimum of 2 business days before the due date. So we need to do this like early next week. But I can't discuss it.
Can you do it by email?
No, it has to, the public has to have the right to speak to it.
Veronica, this for both we have to.
A and B, they're combined, they're connected.
Okay.
When you approve, well, I can't discuss it.
Two separate approvals.
There are 2 separate required board approval
Action items.
Right.
Yes.
And I don't think we should cut it really close. So when do you think, giving yourself time to be able to report the results of the meeting? When you said early next one?
I'm looking at my calendar. It's due on Thursday, the 28th. So the latest I would feel comfortable is next Monday, the 25th. Earlier if we could.
For board members, would it be easier for us to do another meeting later part of this week rather than early?
Yeah, I've got a grant due out Monday.
Because today's Monday.
Right,
Okay.
yeah, would it be better for you to have,
Like Thursday.
Earlier the better,
yeah,
but the latest I could go is Monday the
right,
20th.
but would Thursday, the last week of the month is kind of a blockbuster for many people with other standing meetings. So I was just wondering, would Thursday be better than trying to wait till the early part of the week for some of you?
We need a quorum, right?
Yes.
I can't do it Thursday.
Okay.
So unless somebody else can show up,
You can have someone else come on your behalf.
You can have a designee.
It'll be a quick
I
meeting.
don't think Jeremy. We have a.
I can do Monday, then Joe can come for me.
It doesn't have to be you, it can be your alternate.
Thursday, Friday, or Monday for me, doesn't matter.
1:30? What time are we talking? 1:30?
It would be 1:30,
What day are we thinking?
Monday again.
Monday again, because it sounded like Monday might have to be.
That's, Veronica, you. Sure.
I'm actually pretty open that day.
We're gonna have to check with Sage or other board members who's available.
Monday works for me.
Can we do a tentative next Monday at 1:30 and in between then we'll just make sure we have enough people?
We'll get a confirmation that will work.
But
And get designees for folks that are.
And could Paul pull a travel? part?
Yes,
I'll probably have to send somebody.
Oh, but maybe you could, because it will be only probably a 10-minute meeting, right?
And you might have a.
Yeah,
I don't want to waste that. I don't want to waste a special just cause, right?
it's okay. The calendar starts again in January.
We'll use it up this year.
You got 2 squares on the bingo card, Paul.
Okay, so emergency solutions grant, ESG. The NOFA was released on August 15th for the balance of state funds, and applications are due to HCD by Monday, October 16th. The COC has to approve the rating and ranking, and we have a meeting on the 16th. So that'll be fine. We can make that work. It doesn't have to be publicly posted. There's no minimum standards for that. But that means we are going to have a quorum at our next COC board meeting.
Okay.
Otherwise,
We're back.
it could be very bad for some of our grantees. We could lose out like $400,000 for our entire community if we don't have a quorum at our next COC board meeting.
We need a quorum.
I'm wondering, Veronica, when we do the meeting invites for these and put them if we can really emphasize, do not say yes to this meeting unless you really can come.
So I don't send a calendar invitation because it has created so many issues historically that I send out the agenda, but I don't do a shared calendar invitation.
Should we start doing that?
Yes.
Just for the board members, not for, I think not for,
The problem with that is I can't blind copy them. So if anybody replies all, it's a Brown Act violation immediately.
so let's just make it really clear in there. Do not hit reply all
Right.
to this meeting calendar meeting invite.
And I can do it as an appointment and then share it with people, but that means I can't send updates.
I think we can do an appointment with the board members.
Okay.
Make it really clear, don't hit reply all to this appointment.
Mhm.
And don't say yes unless you're coming. Decline, don't just do it all, yeah, decline if you can't attend.
Things do happen. And so if something happens, everybody
Of course.
needs to have their backup in the wings.
Mm.
That's the other part. Because then we still got the right number, right?
There are a couple organizations who have not appointed
Okay.
alternates. So if there's any board members watching this who aren't in attendance today, please set up
So maybe Dan and I could craft we could use some help message. And remind people that need, this is gonna work better and we've had to postpone again. And schedule another meeting because we're struggling with this, and then encourage folks to do that. Okay. I'll pick that.
You want me to do my full report and then open it up for discussion?
Yes.
Okay.
Sweet.
Then the last funding source I have an update for is HAP. The requests for proposals for funds through rounds 3 and 4 are actively being reviewed. I provided an update earlier in the meeting. And round 5 application will open on September 30th. So I will be working on that one as well. And that is all the funding updates that I have at this time. that I'm allowed to talk about.
Board members, do you have questions for Veronica? Questions from the public? Comments from the public? Then we'll move ahead. Just the announcement that we are continuing to accept nominations for the vacant board seats. I guess Dan and I can put that in our message too.
There's currently 3 vacancies.
Okay. And then the next meeting is. Let's actually class.
Oh, it is a full membership.
Monday.
Excellent.
Yes, we'll see Deja Vu on Monday, and then the following meeting is a full membership meeting scheduled for the 16th of October. Because we have a few minutes before we adjourn, would you like to give people an opportunity to make announcements from your agency? Do you have any announcements?
Project Sanctuary is having their annual fundraiser on September 30th at Nelson Vineyards. It's a little bit different. I don't have the name of comedians, but it's 2 comedians. It's a comedian show. Tickets are $75 and you can get them at the Mendocino Book Company or online at Eventbrite, but you save money if you just go to
And tell me the date again.
the 30th of September, Saturday.
And on the 24th is the Recovery in the Park event that 4th Street sponsors. We're going to try it on a Sunday and not compete with that farmer's market. Last year when we had the public health nurses were there to do help with vaccines, all the people from the farmer's market, it was like, wait, I'm really happy to did this. I mean, I was just like, whose party is that? So we'll see how that goes.
Is that this Sunday?
The 24th. The 24th.
Okay.
Yeah.
It is this
It's
Sunday.
this-
Yeah.
Oh my God.
I was like, I know here.
Monday, right.
I know, it's trippy. It's almost October.
Any other comments, announcements? All right. Thank you so much. Okay, thanks, Lauren.